back to the Morning Blend. Plan your advanced care now. Today is National Healthcare Decisions Day. It's a yearly awareness event to educate and empower you on its importance. And joining us to discuss the importance of advanced directives and advice for getting the conversation started is Healthcare Partners clinical educator Ellen Aliberti, as well as Las Vegas Solari Hospice Care Executive Director Candis Armour. Ladies, thank you so much for joining us.
Thank you. Good morning.
This is an important topic, obviously. Candis, let's talk a little bit about National Healthcare Decisions Day and why it's so important.
Well, it was created to teach people about the importance of advanced care planning, about putting their wishes on paper and making sure that everybody is aware of what they want for their medical care and decisions in the future. So it's very important. Unfortunately, despite its importance, studies are showing us that very few people actually take advantage and do advanced care planning and advanced directives.
And what ends up happening after that is a ton of confusion. And things,
a ton of confusion. Yes, you're right. That's a good way.
And the only way we can broadcast
a ton of confusion.
Exactly.
It is.
So how many of us have a living will? I'll admit I do not have a living will. Smack my hand.
Smack a hand. That's right.
Easily.
What are the numbers?
Well, studies are showing right now that less than 29% of Americans have actually outlined their medical care wishes.
Unbelievable.
Yes, pretty striking.
So what are things people need to know before they create these advanced directives?
Well, first off is to make the decisions on what you do want, what kind of medical treatments that you would like in life-threatening events. What do you want? What you don't want. That's just as important. Not only what do I want people to do in a medical emergency or life-sustaining treatments, but what I might not want. And then also to share them with those people that are close to you. Preferably write them down. You know, not just have that verbal conversation, but write them down, put them in a document that is recognized by other healthcare professionals, by the state where you live.
That this person will be essentially acting as my power of attorney.
Well, that's the second piece, actually. The first part is the advanced directive, and that's where a person tells people what they want, what I want and what I don't want, equally as important. And then the second is to designate a representative that can speak for you if you're not able to anymore.
Okay, understood.
So someone you trust and someone who will act in your own best interest.
What are some of the questions we should consider for ourselves? Because I think we all, we don't want to really picture ourselves to be in this situation. But what are some of the things we should be questioning about ourselves and to put on paper?
Well, I think one of the first things you need to think about is, how do I want to live out the rest of my life? Do I want to live it with family and friends? Do I want to try to stay at home? Or, what are those decisions about? And then secondly, who is going to help me? Who is going to make my decisions if I can? And this is a really important decision to make. You've got to make sure that you select somebody who is going to honor your wishes, even if they go against what that individual, your family member wants. It's incredibly important.
No question.
Yes.
And I think a lot of people, especially the younger generation, we're like, that's down the line. You say, it's not down the line, start it today. I
say today, and you know what, let me back up, Sean, and say today is National Healthcare Decision Day, and I love this day because really it's taking out and destigmatizing what it's about to decide about your advanced life choices. It's a great day, and you're never too young because even what we saw happen yesterday, unfortunately, just calls to mind that we all have to be prepared for the inevitable or the unfortunate, things that are occurring. Get prepared, make some decisions today, and it's a great day to do it. National Healthcare Decision Day.
Absolutely.
And Healthcare Partners, we support this in our organization. We really counsel our patients all the time about filling these out, not because they're sick, but because they're well, and we want them to stay well and make good decisions before they get sick.
I was about to say that Healthcare Partners, a lot of it has got to do with education and educating yourselves to empower yourselves.
Right. Education about, this is your life, take control, make it a gift for yourself. I've said that before. It's a choice, it's a gift. We've got to do this, all of us.
What other services does Healthcare Partners provide?
Healthcare Partners, first of all, we're getting so big. We've got 300 primary care physicians now.
Wow.
We have 1,700 specialists and ancillary providers. We provide seamless wraparound care coordination for our patients. We educate them about staying healthy, and we also educate them about chronic disease and how to maintain it and manage themselves.
Absolutely.
Because after all, it's their disease.
And I know there's a lot of care for aging patients as well.
We love our seniors, and we're really absolutely, so many of our services are really focused on our older adults because they need more services, guidance, and education. So we love our seniors.
You guys love everyone. Come on, let's face it.
Come on, we do.
Everyone's loved.
Healthcare partners, yes, we do.
If people want to get the ball rolling, where's the first place to start?
Pretty much anywhere. You can get Solari Hospice Care. I can go to any of the websites, Google, Yahoo, whatever, put in the search engine, Advanced Directives, Living Will. You'll come up with all kinds of sites. There's mostly free downloads to provide for the documentation.
And once it's written out and printed
easy.
out, where do we put it to make sure it's in a safe place?
In your house, if you happen to go give it with your doctor, leave it with your primary care physician. If you go to the hospital, to the person that you trust the most, that you're signing up as the designee for your power of attorney. You really can't have it too many places, if you ask me. So it's not something to keep hidden. It doesn't have to be filed with a lawyer or any of those things. So it can be a very simple document.
No question.
Right, and just last but not least about healthcare partners and Solari, Las Vegas Solari being part of the healthcare partners family. We're going to have better communication with our providers and our patients, and it's just great to have you in the family and move forward with the kind of care that we're wanting to provide to Las Vegas.
No question. It's a pleasure having you ladies in.
So great to be here. Thank you.
Thank you so
Fill
much.
out those advanced directives.
Do advanced directives.
Today.
Move on. Information
We brought two.
for Healthcare Partners Medical Group, as well as Las Vegas Solari Hospice. They're on your screen. You can also see this segment again on VegasMorningBlend.com. You better get it done, or she'll come out there. She'll find you.
You know I will.
Still ahead on the Morning Blend, giving